Okay, so there's a couple things that you need to know. One is your body doesn't track oxygen levels. It really is good at tracking CO2 levels. That's why you can be walking along and have no oxygen and just pass out without feeling like you're suffocating. Secondly, when CO2 levels rise, nitric oxide levels also rise. They're buddies. When CO2 levels decrease, nitric oxide levels decrease. CO2 is kind of the more signaling dominant, and nitric oxide is just better and faster acting and better at vasodilation. So they're buddies. They tend to go together. Now, in a healthy individual, let's do an example when you're working out, right? Your muscles are contracting and they're basically acting kind of like a fire. They're consuming oxygen and they're releasing carbon dioxide. When they release carbon dioxide, it gets absorbed into the blood and some of it turns into carbonic acid. And that acid signals to the red blood cells that they can release oxygen. It makes it easier for them to release oxygen. Because that's great, because you got one muscle over here that's working, you got another muscle over here that's sleeping. You don't want your oxygen to go to both of them evenly. So the red blood cells going along and they go, oh, this muscle is working out. Let's give it some oxygen. Now on the breathing end, your oxygen level for the most part is highly regulated. You're always kind of like at 98%. Only if you're really off is something bad. So when we do these breathing exercises, we're not changing the oxygen level, but we're changing the CO2 levels. And if you can remember, CO2 and nitrous oxide go hand in hand. So when you increase your breathing rate, it's not like you're getting more oxygen, you're expelling more CO2. You're breathing out more CO2. And when you're holding your breath, you are allowing your body to build up CO2 in it. Okay. Now, individuals with metabolic disorders, they can either again be too high or too low. Generally, in acute conditions, you can think of too much inflammation and their CO2 levels are too high. So you want to focus on breathing out more, which is the huff and puff. Now, with chronic individuals, people that have suffering a long time, usually they have damages of their blood vessels. So it's hard for the body to create nitric oxide. In those individuals, slightly holding your breath increases CO2 levels, which again increases nitric oxide levels and helps the body. Now, the body can be healthy, blood pressure can be fine, oxygen levels can be fine, but microscopically, you can have dysfunctions in the capillary beds, where some of them are stuck open and some of them are stuck closed. And when you're doing these breathing exercises, you're helping the body regulate opening and closing of the microcapillary beds. You're helping the body regulate itself on a microscopic level. It is also kind of similar to what you do with exercise, right? Exercise would do all this, but people with chronic conditions, it's difficult to exercise. So you should, of course, be exercising because this will help your cardiovascular function. But breathing exercises is also a gentle way to get a lot of the benefits of exercise without the damage of inflammation and fatigue that can happen with chronic conditions and POTS and other things like that. Hopefully that's helpful. Hopefully that's good information. Correct me if I'm wrong. I love this stuff. I look forward to hearing why this is incorrect in the comments. Thanks. Or in another stitch.